Okay, let's spend a couple minutes talking about the integrity of our tubing. So, when you have an IV pull like this, right? You've got your tubing on here. The weight of the tubing on top of the other tubing is going to put stress, especially on your longer tubes like primary, portless. So when it's hanging like that, or, we had OSCE testing maybe 2 weeks ago. This is my side work. I'm getting to it when I can, right? That being said, we need to address our weak points. So, particularly, where did it go? Okay, so here's our weak point. This is where it was dangling, okay? And that's okay. That's fine. You're going to get it in the middle of your tube. So, how we can handle this, before you repackage, take your roller clamp, don't close it, but position it where your weak point is, okay? So that it can stop your tubing from being kinked when you repackage it. So let's say you have tubing that is discolored, okay? You're going through, you're picking out what you can keep, what you're sorting, right? So let's say you've got something that's discolored, right? A little discoloration's fine. That's to be expected when you're running alcohol through your pump. Keep in mind, it's a dilution of purified water and alcohol that we're running through our pump. It will dry out over time, and it will make a little bit of cloudiness on the inside of the tube. That's okay. That's fine. It's when it begins to get kinked and what I call crunchy. That's when we want to take it out of circulation, because if it's kinked, you're going to get a pump error, right? So what do we do in that situation? Because in my opinion, we can still use that tube for something else at least one more time. So what I've been doing is setting aside donations, okay? So we have a physical therapy program that shares our campus with us. And they often use our space so that they can teach a class that they call lines and tubes. So what I did is I put aside some packaged tubing that is kinked, maybe discolored to the point where it's just distracting. You can take it and give it to another program as a prop. So they use this as a prop, they tape it onto their arm, and then they teach the students how to transfer a patient in and out of the bed who has Foleys, which we also donate lots of Foley bags to this program. Just because we're not going to use it again doesn't mean, or its intended original purpose, right, to put it through a pump. Just because we're not doing that doesn't mean that we can't find one more use for it before it goes in the trash. So another donation that we like to do is to our SP program. So when we have standardized patients, a lot of the time their moulage requires them to have a prop, right? So if they need to portray a patient that has an IV, they can tape this on there and use it as a prop. It's not going through a pump. It can be used one more time. Donation. So here's an example of something that we're going to donate to an SP. This is here. This is one that has been recycled many, many times. It's ready to retire. So you can see that in the drip chamber, it is quite cloudy to the point where it's going to be distracting for a student to use. So we can donate this to an SP instead. Still works perfectly fine as a prop. Okay, so when it comes to repackaging, right, we always make sure to put a date in the package itself. That way we can determine how long it's been sitting on the shelf, right? It's no secret to anybody that something that has had alcohol in it is going to dry up, right? So when it dries up, it's going to be a lot more susceptible to kinking and discoloration because it's sitting on a shelf for a while. That's normal, right? So I've kind of come to the conclusion that anything that is 6 months or older should be pulled off the shelf and donated to another program as a prop. In doing so, one way that I've been able to clearly separate what is going into this donation pile and what is going into our recirculation pile is highlighting the label itself. and being like, okay, this one's definitely going to donation. Because one of the hardest things about this repackaging program is determining what is recycled, what is new, what is going somewhere else, what is coming in. It's all a game of labeling, basically. So yeah, this is what we do. This is how we determine if it's going in the donation pile or not. And if it gets separated from the donation pile, we know what it is. Okay, happy recycling!